So we're just going to talk about relapsing polychondritis and its neuro-ophthalmology manifestations. And relapsing polychondritis has no biomarker, so there's no laboratory study. It's completely clinical. It's relapsing because it just comes and goes, so it's a recurrent autoimmune inflammatory mediated condition. It affects poly, which is many, and chondro is cartilage. So it's itis, inflammation of multiple cartilage. And the cartilage that it normally affects is your ear, so all the cartilaginous portion of the ear, but not this fleshy earlobe part, and your nose, but the cartilaginous parts, so it can cause a saddle nose deformity from loss of the cartilage, or can be inflammation of the alar cartilage on the nostril. And so these two are the two predominant places that the relapsing polychondritis occurs: inflammatory, painful, red, hot, swollen nose and ear, but it can affect your tracheoesophageal cartilage and also your cardiac and your heart cartilage. So for neuro-op, the way it comes to us is orbital inflammatory pseudotumor, so inflammation in the orbit, or just like the cartilage of your nose and your ear, there's like a connective tissue of your eye, and that is scleritis. So it can present with a red, hot, swollen, painful eye. If it's in the front of the eye, anterior scleritis. In the back of the eye, posterior scleritis. If it's in the orbit, orbital inflammatory pseudotumor. And as with all the autoimmune inflammatory disorders, there are central nervous system cases, but they're rare. So you need to know about relapsing polychondritis. It has no biomarker. It presents with a very characteristic feature: red, hot, swollen nose, ear, and sometimes eye.